A very good morning, ma'am.
Good morning, Shreya.
Ma'am, we'd like to have a brief introduction of yours.
Okay. So I'm Dr. Nalanda Borkar. I'm basically from Nagpur, and I have joined Alard Institute since last 2 years. I'm working as a HOD over here in Department of Pharmaceutics. Also, I'm associate professor at M.Pharm level and Pharm level. I did my graduation from Nagpur University. I did my PG and PhD from Nanded University, and I love to read books. I love to cook. So these are my personal hobbies, and the main passion of mine is I love to talk with persons, or like my profession is teaching, so I love to talk, communicate, express, and help others. Thank you so much.
Thank you, ma'am. What do you think about how the COVID-19 situation has hit the education industry in different ways?
Shreya, if you ask me related to COVID-19 and our education system, so being an academician, the main motto of ours is to, be in touch with the syllabus, give the detailed knowledge to the students, and that's actually happened when we take a classroom study in which in front of us students are sitting, we are communicating with them, we are discussing the topic with them, and from their facial expressions or verbally asking them questions, we come to know is the candidate is getting the point, getting the concept, clearing all the concept that we are discussing. But because of this COVID-19, what happens, virtually everything is conducting lectures, explaining them, and the basic lacuna of this virtual practice of academic is practical. Conduct of practical is very much difficult for us. Virtually it's become very difficult to demonstrate. We demonstrate, we show them a video, we demonstrate them, we write key points, key notes, but it's difficult to develop the skill which is required in our pharmacy. Like basically I'm in the Department of Pharmaceutics, and pharmaceutics deals with the formulation, development, and preparations of many doses form. Like if we take like capsules, like tablets, we manufacture syrup, we manufacture suspension, we manufacture creams, lotions, lipstick, means all the products which we get from the pharmacy shop. The main manufacturing, research, development, and formulation involved in our department. So developing the skill in the student, it's very much difficult in virtually, if you ask me, and we are trying at our level best. So let's see, we'll cope up with this situation. Thank you.
Ma'am, being the HOD of Alard College of Pharmacy, what is your philosophy of leadership? How do you describe your leadership style?
Oh, if you ask me leadership, I would not say I'm a leader. I'm just a person who work in a team, who like to work in a team. So I would say I always ask my fellow colleagues to work with me in a team. If they find something to give suggestions, I welcome their suggestion. In our department, I used to delegate the work depending upon the faculty's caliber. We have around 5 to 6 person in my department, so I handle the subjects also accordingly as per the knowledge of that person, as per the caliber. So that's just a teamwork that we do. And the thing is I am the IQSC coordinator of Alard College of Pharmacy. So I always in touch with improving the things in our institute, as we ongoing with so much of projects, so much of extracurricular activities, so much of academic work in our organization. But I always, I believe that everything is not still, everything is not, bound to one thing. So we need to improve what we are doing. So improvement is the target of mine. and just a teamwork.
Okay, ma'am. Ma'am, what are the benefits and career options after pursuing pharma from your college in different departments, basically?
Different departments, okay. So see, pharmacy is one of the versatile and one of the growing, we can say, technical education that one can take. Being a professional pharmacist, I would say there are vast number of career opportunities in this field. Like one can go for regulatory affairs, one can go for intellectual property rights, one can go for in industry. We have a position in research and development, F&D. We have positions in quality control, quality assurance department. And if we say in pharmacy field we have jobs also, and we have business also. Jobs we can do in pharma companies, we have government jobs also, like drug inspectors, then chemist and druggist, then hospital pharmacist in various government hospitals. We have a position of hospital pharmacist also. Then if we say for business, we can open a medical shop, a retail pharmacist, wholesaler pharmacist, druggist, chemist, Ayurvedic pharmacist, Yuna, Siddhani, homeopathy. All these medicines we can sold as a part of our business activity. So there is a huge number of opportunities as a graduate, as a postgraduate, or as a doctorate in pharmacy. And last but not the least, the main thing, that is academic, in which I'm involved personally. So this is the field where one can express or one can give their research knowledge, one can share their research knowledge. If he or she is, like to communicate, like to share their knowledge and improve themselves. So academic is one of the good position that we can handle as a career. Thank you.
Ma'am, how do you plan on using the immense knowledge and experience you have gained and being an integral part of this institute?
See, basic thing is we can say is teaching, by guiding students. And I also used to being an head of the department, I used to take meetings with my faculty team. We had communication, we had interaction. So at that time we discussed related to lacunas, what we are having in our syllabus or in your subject. So, and at that time we share our knowledge. So basic, if you ask me, that I am just a person who just tell them what we can use to improve our thing in order to get a better position. So basic thing is teaching and guiding, and I also demonstrate various practicals to the students, so they can develop their skill. Like I can share one example with you. Like if we go for tablet preparation, so basic skill in case of tablet preparation is, first step is to prepare a granule. So few of means it's a very skill thing that we require to prepare a granule, how proper drying is required, how the machine can be operated. So through demonstration also one can share a knowledge. So that I used to do. I used to just communicate, I used to share my knowledge, and I used to demonstrate. With my faculty also we used to share, we used to communicate, and we take the feedbacks also, and accordingly we work on it.
Okay, ma'am. What is your opinion, ma'am, on the National Education Policy 2020?
See, for this question, I would say I'm not the right person to answer, but I would say whatever the government feel, it should be for the betterment of students. Thank you.
Thank you, ma'am. What are some of the plans that you are currently designing for Alard College of Pharmacy, Pune, for its students?
See, for student, if you ask me, technically we are, Savitribai Phule Pune University, and we used to, we complete the syllabus which is given by them. But besides syllabus, we used to focus on gaps which are there in syllabus and the marketing. Pharma field is a technical field which we need to we need to have a strong communication with what is going in the market, so that we basically focus. We used to guide the student related to new research, related to new launch of drug, related to new launch of doses form in the market. That is one thing. And second, and the most important thing is we used to improve the research strength in the student by giving them a small topic so that they can work on it, they can research on it at their graduate level. See, in M Pharmacy, they have a research, background, as they are, basically focused on doing research in their M Pharmacy level, that is PG level. But on UG level also, we focus on giving them minor research project. We guide them, and we used to complete that research. And the main motto is to publish that research work in a good reputed journal, so that we can get a good impact factor. We can get a level of strength. What we are having in our research, we will get when our research get published, the name of Alard College of Pharmacy will be known to everyone, and the student will also get recognition. So that will build up a confidence in students. So that's the main thing I used to focus. Thank you.
Ma'am, what do you think that Alard College of Pharmacy's top priority over the next 3 years should be?
Okay, so being an IQSE coordinator, as I earlier told you that I'm the IQSE coordinator. So my vision, my mission will be to get a college at the top level. The future plans will be, we are planning to get the D Pharmacy at our institute, as we are currently running with the graduate and postgraduate level. So we will also try to get the D Pharmacy part. And the main thing is we are developing, means we are working on it. We are trying to working on getting a PhD research center at our institute. So that's the main vision or mission of mine, if you ask me. Thank you.
Will you please throw some light on the extracurricular activities conducted by Alard College of Pharmacy?
Oh, extracurricular. If you ask me, Alard Institute is completely a student-oriented, college, and we give a platform to our students to explore themselves, like in sports activity, cultural activity. We organize various intercollegiate competitions also, like Pharma Quiz. We have a Pharma Week celebration also, in which we used to, take a pharma rally in this Marunje premises and Marunje area. We throw some lights on physical awareness of people. We also conduct various social awareness activity. We have conducted breast awareness camps. Then we also have, conducted over-the-counter medicine use, like some of the people who are, not aware that medicine should be only taken by the prescription of doctors. So few of the people who are living in this area, in this Marunje area, so we just sent a student there. They did workshop, they counsel, and we also had a blood donation camp at our place. Then in cultural activities, dance, singing, dramas, video making competitions. So this is a at Alard we give a platform to the student to showcase their activity, to explore their hobbies. And the important point in this extracurricular event is we follow rubric system. So what is this rubric system is? So in this rubric system, we give a certain kind of marks to their activities. Like if some of the student participating in sports or other cultural activities, so we have assigned some marks on it, like 5 marks for sports or 3 marks for dance competition, and likewise. So we completely give a 10 marks for this rubrics, that is extracurricular activity, and that is counted in their academic work. So this is the plus point, so that they can increase the number of participation of students in extracurricular activity. So this is the best part. Thank you.
Thank you, ma'am. Knowing about this rubric system is really enlightening.
Yeah.
What would you like students to know about Alard College of Pharmacy that they might not already know? Like the USP of your college.
Okay. So the USP of Alard College of Pharmacy is completely a student-centric premises or student-centric college, we can say. We have a student core committee in our institute, and we involve the representative from that student core committee in planning the activities of our whole academic session. Like we have anti-ragging committee, we have student grievance committee. Then the most importantly, in case of anti-ragging and student grievance, we know we have a squad. So in that squad also we have involved a number of representatives of students in that. We have a hospitality team. In that also we have a representative. Then academic monitoring committee we have. In that also we have one of the student representatives. So likewise we have different internal college committee at our college level, and we involve student in there. So our principal, respected Dr. Sonia ma'am, personally feel that we always involve the student, because what the college is for, the college is only for the student. Because of student, we run the college, and because of students only, this college, gets or feels like a temple of knowledge to us. So in order to share the knowledge with the student, to whom we are sharing the knowledge with the students only. So students are the most important priority for us, and our management also, respected Dr. Alard Yadav sir, has also given us a permission for this to involve the student in this various committee, and hence we work as a team, we work togetherly. Thank you.
Ma'am, any suggestion that you would like to give to the current and the aspiring students?
Okay, suggestion. I would say the student should focus on what they love to do. Because if you choose a profession, like currently now the situation is of 12th pass students giving CET exam, NEET exam, JEE exam, and most of the students get depressed. Oh, I score really less in NEET, and how could I get admission in medical? So I feel, in case of a pharmacy, this happened particularly. If we ask student why you have taken admission in pharmacy, so students said like, ma'am, I scored very less in NEET, so I don't get admission in MBBS or any other field in medical, so I have chosen pharmacy. So this is not the case. One should focus on what he or she loves. So whenever you choose a path that you love, then and then only you can succeed in your life. So I would only say, student, just be focused, just love your passion and do your work dedicatedly. This will, achieve a milestone in your life. And you will be shining as a, 7-star in the world. Thank you.
Thank you, ma'am. Thank you so much for your time.